To set the stage for tonight's discussion, I want to discuss one potential healthcare proposal which has attracted a lot of support, and that is a proposal that would raise your taxes, swell the federal deficit, and leave more Americans without insurance. This plan, call it Plan A, will grow the cost of healthcare 3 times your average wages and will double, triple, and even quadruple your premiums over the next decade. Plan A will continue to increase out-of-pocket costs for people with insurance by an average of 32% over the next few years. This same plan will direct that 1 out of every $5 spent in this country will be spent on health care, and it will wrestle 1/3 of the country's economic output and tie it up in the healthcare system. This plan that we're calling Plan A will increase costs that will devastate families and businesses, keep wages flat, stunt our economic growth, allow insurers to drop you if you become too expensive or too sick, allow them to refuse to cover you if you have a pre-existing condition, charge you more if you're a woman, and put no limit on your out-of-pocket costs every year. This plan, Plan A, as many of you have guessed, is the status quo. This plan does not sound like a good plan to me. And that is a plan for those of us who are already insured. Plan A also leaves approximately 50 million citizens in the United States uninsured, and approximately the same number who are underinsured, and offers them little hope of accessing quality care anytime soon. So the starting point, in my view, is a plan that leaves millions of Americans with a difficult choice of whether to pay their medical bills or pay their mortgage, because they can't afford to do both, and that forces many others into bankruptcy or foreclosure. 2/3 of all bankruptcy and half of all foreclosures are the result of a healthcare crisis in the family. As a nation, we spend almost twice as much per person on healthcare as any other country, or about 16% of our GDP. We're paying $6,000 more per individual on healthcare than any other industrialized nation. And for all the money and some of the best providers in the world, our healthcare system does not produce the best outcomes. According to the WHO, the United States ranks 37th in terms of healthcare performance, and is far behind many other countries in indices like infant mortality, life expectancy, and preventable death. As we speak, committee chairs and our leadership are working to resolve differences in 3 bills that are before the Congress. And I would like to encourage you to share your thoughts, your input, and suggestions. None of us are omniscient, I certainly am not, and we would welcome your feedback on what you like and what you don't like about the current proposals. The Senate has moved at a slower pace. A bipartisan group of 6 senators in the Senate Finance Committee have been meeting daily for weeks to produce a bill in the Senate. But there's some provisions that we know in both the Senate and House bills are likely to make the final version. And they are bills that would prohibit the rejection of coverage based on pre-existing conditions. They would eliminate charges for preventive care, eliminate lifetime caps on coverage. These are provisions that are essential for maintaining stability and access to quality and affordable care.
People don't want to hear about how they're going to get killed.
Both versions would also establish an exchange for consumers where they'd be able to compare plans side by side and purchase affordable coverage. One of these options would be a government-run public option.
I know she is.
half of you will like this and half of you won't, but I believe that a public health insurance option would provide greater choice to families. Well, it's important also to provide competition with private insurers. And act as an incentive for them to lower administrative spending and use more healthcare dollars to provide actual healthcare. I've been working on two fiscal concerns I have with healthcare reform.
Before it kills my
How to reduce
grandmother.
healthcare costs for those who have coverage already, and how do we ensure we don't swell our deficit and national debt. We've taken important strides, but there is more that we can and must do. But I want to make sure to hear your thoughts tonight, and it gives me great pleasure to introduce our moderator this evening, a wonderful doctor and a very brave moderator, and that is my friend Dr. Bruce Hensel. Dr. Bruce Hensel.
Thank you, Congressman. I know you have many points of view that you want to be heard tonight. We are here to listen as well as to speak. So your courtesy to others will enable you to be heard. As I was meeting with the congressman the other day, we were talking about a story that I had heard from a friend that I think is particularly appropriate, and that is the invisible man comes to see his doctor. The nurse goes into the doctor and says, "Doctor, the invisible man is in the waiting room." The doctor says, "Well, tell him I can't see him right now." I know that many people feel that way and have felt that way for a long time. There are many people trying to change that, and there are many opinions about how to change that. I think one thing that we can all agree on is that the past and changes have gotten us into a hole, a situation, a quagmire that is difficult to escape from, to find ways to get everybody the care that they need and to do it in ways that will not cause more problems than it solves. As the congressman told you, I teach at UCLA and I continue to take shifts. I'm aware personally of the problems of physicians, medical companies, and patients. And our reason for being here today is to talk about some of the things that are being proposed to change those problems, to solve those problems, as well as to hear your point of view. And as I said, you can help us to hear your point of view if you remain as you are now, and certainly express how you feel throughout the time that we are here. But give respect to everybody who's up here and to your fellow citizens who have come here to be heard.